Okay, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment, which is the inside part of the knee. And right now we can see the arthritis you've got. You can see some wear and tear changes on the femoral condyle there. I'm going to rotate the camera a little bit so we can get a good look at that. There you go. So we can see this area here. We've already taken away some of the loose bodies that were floating around. That was the main reason we were here. And now we're going to look at this meniscus. Hold the camera there. We're going to try and open up this compartment a little bit. And you can see a few more of these loose bodies floating around. Most of those little ones will come out with suction. And now we'll put in our shaver to help smooth out what's left behind here. Focus that a little bit better. Okay. And you can see there's a little flap of cartilage hanging down here in the posterior aspect. We're going to work on that too. We don't want to leave anything loose. Okay, so we're all done here. We looked in the lateral compartment. It was actually pretty normal. And the other area where you have a lot of arthritis is here in the patellofemoral compartment. So we did a little bit of a lateral meniscectomy, and here you can see this loose articular cartilage in the trochlea. We'll work on that a little bit, but then we'll finish up. So we've really documented you've got essentially grade 4 changes in the medial and in the medial and patellofemoral compartments, grade 2 in the lateral, and then these meniscal tears. So that plus a few more loose bodies up here, which we've already removed, and that ought to hopefully give you a little bit of some symptom relief. So good luck to you now. Bye-bye. Basket.